Hey, good morning, everybody. It's Congressman Jamie Raskin coming to you Friday, October 20th, 2023, for a beautiful day in Maryland's beautiful 8th Congressional District. It's my favorite time of the week, Local Hero, when we get to recognize the people who are improving life and the quality of well-being for all of our people. Today, we've got a very special local hero for you, and we're using it to mark the Nadim Khan Memorial Homeless Resource Day, which was yesterday. And our local hero is Kim Ball, who is the acting deputy chief and homeless services administrator within the Department of Health and Human Services. She's worked for MoCo for 36 years in the Behavioral Health and Crisis Services Department. She participated in the development of several county initiatives, including substance abuse services for women, which is now called the Journey for Women, the development of Avery Road, the Avery Road Combined Care, and the implementation of targeted case management. She's helped lead the services to end and prevent homelessness, the 100,000 Homes campaign, Homeless Resource Day, ending veteran homelessness, and currently Home Together, ending homelessness for households with minor children, on and on. She's addressed every aspect of the problem of lack of housing in our county. And so I can't think of anybody who's done more to promote housing for our people than Kim Ball. Kim, you are our local hero today, October 20th.
Thank you so much for having me.
We're very grateful to you. It seems like the homelessness problem often gets more intense with certain kinds of social crises, whether it might be a war, it might be COVID-19. We can see a growth around economic recession. But have we seen over time, through all of those shocks and crises, an improvement in the situation for housing people in our county?
So the answer is yes. Through all of our initiatives with Montgomery County, we have been able to address a lot of our homeless situation. That is a challenge, though. As you were just saying, the pandemic did change a lot of our landscape. With the work of our programs and initiatives, we combined receive over $10 million from our housing urban development, and we are able to provide supportive housing for a lot of our clients that are vulnerable and have been unsheltered. We also are trying to address that more on our prevention side. So we get a lot of services and funding from our prevention, trying to keep people housed and keep people safe. The pandemic has changed a lot of our landscape. So we are beginning to see an increase of homelessness, more so than we did in the last, during COVID, unfortunately. We were able to keep people housed. We were able to keep them safe. Now there is more evictions coming in, and we are beginning to see a little bit of an increase, and we're addressing that by more supportive services.
But are we making progress within particular subpopulations? For example, the effort that you were involved in with veterans, has that actually succeeded in ending veteran homelessness in Montgomery County?
So veterans are one of our major priorities. And so we did end veteran homelessness, and ending is a strange word, for example. So when we say ending, we basically say, do we have enough resources available to allow people to get rehoused rapidly? So we have seen an increase of our veterans coming into homelessness too, but we're able to get them housed quickly. So what we say is our ending number is to have no more than 8 veterans homeless. And we maintain at that number. We go up a little bit, we go down a little bit. So right now we're able to make sure that we make our priority to save and prevent homelessness for our veterans. And that means yes. So we're able to do that, and through a multiple of housing resources.
Is there a single profile or a majority profile of who a homeless person is in our county? I mean, is it is it a single person with substance abuse? Is it a family that's fallen on hard times, like how should we think about the population we're trying to?
There is no single profile.
Yeah.
We have a lot of homeless, and as you know, probably, we are receiving multiple, newcomers coming to the doors of our Vice President Bethesda. So we're serving newcomers, which is a new landscape area for us. We're trying to make sure that people coming to Montgomery County, Washington, D.C., the jurisdictional around us, we work together to make sure we're serving everybody. But in particularly, no, we do have multiple issues that are affecting homelessness. So it could be loss of employment, it can be disability, it can be medically vulnerabilities, substance abuse, and mental health.
Yeah. The substance abuse and mental health are a constant, right, in terms of the homeless population. As other things maybe shift, like that's something that we know we need to be addressing. I mean, I've had people testify before me in Congress who've said that the homelessness problem is a substance abuse problem, is a mental health problem, or untreated mental health problem as people abuse drugs or alcohol in order to self-medicate and living on the streets. Well, say a word, if you would, before we go, Kim, about what doing this work for such a long period in Montgomery has been like for you, and how you've been able to maintain your energy and your devotion and your optimism about making headway.
Oh, thank you. I couldn't have done it without the support of multiple people throughout my 36 years. So when we talk about behavioral health and we talk about our mental health challenges, it's been a constant road, but I've had support from all of our programs and Department of Health and Human Services. We work together to address those things and to maintain those things. I think the biggest support that I've had is of our staff and our colleagues is the support of all of the agencies working in collaboration. So our biggest success is when we work together to solve and address the client, the household, the constituent, whatever you want to call them, because it is their lives. We at Services to End and Prevent Homelessness are focusing on housing, but if we aren't addressing the behavioral health, if we aren't addressing their medical, if we aren't addressing all of their needs, they're coming back to us and they're coming back to all of our services. So serving somebody, helping one person at a time, as we say, helps us to end homelessness and support our community.
Well, you're a true public servant, a true community servant, and we want to thank you for everything you've done for 3.5 decades and everything that you do every day to help our people. You're a local hero. Everybody, please send an email or call up Kim Ball to congratulate her for all of the great work she does for us. Thank you.
Thank you for having me.